Dr. Heather Sandison discusses some of the earliest warning signs of Alzheimer's disease, which can start years before an official diagnosis. These include struggling to remember names of people or objects, feeling overwhelmed by tasks that used to be manageable, like cooking a big holiday meal, and having difficulty planning or coordinating travel. A diminished sense of smell can also be an early indicator, though this can have other causes as well. Dr. Sandison emphasizes that neurodegeneration leading to Alzheimer's can begin decades before the first noticeable symptoms appear, highlighting the importance of early detection and prevention. Dr. Sandison explains the concept of a cognoscopy, developed by her mentor, Dr. Dale Bredesen. This comprehensive assessment looks at 6 key components of brain health: toxins, nutrients, stressors, structure, infections, and signaling. The goal is to identify imbalances that could lead to neurodegeneration. Dr. Sandison breaks down each component. Toxins include heavy metals, mold toxins, and chemical toxicity. Nutrients involve ensuring proper levels of essential vitamins and minerals while avoiding excess sugar. Stressors encompass both physical and emotional factors. Structure refers to both molecular structure, like genetic predisposition, and physical structure, such as sleep apnea or traumatic brain injuries. Infections that can impact brain health include Lyme disease, herpes simplex virus, and gum disease. Signaling involves hormones and other chemical messengers that affect brain function. By assessing these areas, practitioners can develop a personalized approach to preventing or addressing cognitive decline. Dr. Sandison discusses recent research showing promising results in reversing cognitive decline. She cites 3 key studies. 1. A 2022 study by Dr. Bredesen's team published in the Journal of Alzheimer's Disease, which showed 84% of participants improved their cognitive function over 9 months using a comprehensive lifestyle approach. 2. Dr. Sandison's own 6-month study, also published in the Journal of Alzheimer's Disease, where 74% of participants with more advanced cognitive decline showed improvement. Number 3. A 2023 randomized controlled trial by Dr. Dean Ornish, published in Alzheimer's Research and Therapy, demonstrating significant improvements in cognition and function after just 20 weeks of comprehensive lifestyle changes. These studies challenge the conventional belief that cognitive decline is irreversible and highlight the potential of lifestyle interventions in addressing Alzheimer's disease. Dr. Sandison emphasizes the critical role of diet in brain health. Her top recommendation is to eliminate processed foods and focus on whole, minimally processed foods. She advocates for an organic ketogenic diet, which can help reduce inflammation and support brain function. However, she also acknowledges the potential benefits of plant-based diets, as demonstrated in Dr. Ornish's research. Dr. Sandison suggests that the ideal approach may involve cycling between periods of ketosis and a more plant-based diet. She emphasizes the importance of metabolic flexibility and notes that continuous glucose monitors can be valuable tools in understanding how different foods affect blood sugar levels. After diet, Dr. Sandison identifies sleep and stress management as crucial factors in brain health. She highlights the significance of treating sleep apnea, which can have a dramatic impact on cognitive function. Dr. Sandison recommends sleep studies for patients with cognitive decline, as addressing underlying sleep issues can lead to significant improvements. For stress management, she suggests adopting a meditation or prayer practice, particularly before bedtime. Dr. Sandison also discusses the importance of social connections and community engagement in maintaining cognitive health, citing research showing that societies that value and respect elders tend to have lower rates of dementia. Dr. Sandison emphasizes the importance of both aerobic exercise and strength training for brain health. She explains that exercise helps maintain muscle mass, which is crucial for preventing falls and maintaining independence as we age. Exercise also supports cardiovascular health, which is essential for proper brain function. She recommends a combination of aerobic activity, strength training, and dual-task exercises that combine physical and cognitive challenges. While emphasizing that supplements cannot compensate for a poor diet, Dr. Sandison outlines several supplements that can support brain health. 1. A nootropic stack. She recommends Qualia Mind. 2. Fish oils, 4 to 5 grams of EPA and DHA daily. Vitamin D3 with K2. 4. Probiotics. 5. Digestive enzymes. She also mentions the potential benefits of creatine for cognitive function, though she recommends assessing individual needs based on lab work and symptoms. Dr. Sandison discusses the increasing awareness of environmental toxins' impact on brain health. She identifies mercury, glyphosate, and ochratoxin, a mold toxin, as 3 of the most concerning toxins. She explains that these toxins can contribute to inflammation and neurodegeneration, and emphasizes the importance of testing for and addressing toxin exposure as part of a comprehensive approach to brain health. Dr. Sandison highlights 4 key infections that have been associated with Alzheimer's disease: Lyme disease, the bacteria associated with gingivitis, herpes simplex virus 1, and COVID-19. She explains that these infections can trigger inflammation and the production of amyloid plaques in the brain. She recommends aggressive treatment of these infections when identified and emphasizes the importance of maintaining good oral health to prevent gum infections that could impact brain function. Dr. Sandison discusses the potential role of peptides in cognitive enhancement and brain health. She mentions specific peptides like dihexa, which is being studied for its effects on cognition. She also explains the concept of oxygen therapy, including hyperbaric oxygen treatment and contrast oxygen therapy. These approaches aim to improve oxygen delivery to the brain and stimulate cellular repair mechanisms. Dr. Sandison addresses the emerging interest in GLP-1 agonists, medications primarily used for diabetes and weight loss, in the context of cognitive health. While not opposed to their use, she views them as part of a comprehensive approach rather than a standalone solution. She suggests that these medications could help reduce inflammation and cravings, potentially making it easier for patients to adhere to brain-healthy lifestyle changes. Dr. Sandison explains the concept of hormesis, where controlled stress on the body can lead to improved resilience and function. She discusses various hormetic approaches that may benefit brain health, including fasting, exercise, hot-cold therapy, and contrast oxygen therapy. These techniques aim to stimulate the body's repair and regeneration mechanisms, potentially leading to improved cognitive function and overall health. Dr. Sandison emphasizes the critical role of social connections and community engagement in maintaining cognitive health. She cites research showing that societies that value and respect elders tend to have lower rates of dementia, even among individuals with genetic predispositions to the disease. She encourages maintaining strong social ties and finding ways to contribute meaningfully to one's community as essential components of a brain-healthy lifestyle. Despite the alarming statistics surrounding Alzheimer's disease, Dr. Sandison expresses optimism about the future. She believes that with the right approach, Alzheimer's could become optional for current generations. This optimism is based on the combination of lifestyle interventions, emerging medications, and potential future therapies like stem cells and exosomes. She emphasizes the importance of addressing root causes, particularly the quality of our food and farming practices, to create a healthier society overall. Dr. Sandison concludes by emphasizing that while there is no magic bullet for preventing or reversing cognitive decline, a comprehensive approach that addresses multiple aspects of brain health can yield significant results. She encourages listeners to focus on the fundamentals of diet, sleep, stress management, and exercise while remaining open to emerging therapies and technologies that may offer additional support. Dr. Sandison's work, as detailed in her book, Reversing Alzheimer's, the New Toolkit to Improve Cognition and Protect Brain Health, provides a roadmap for individuals looking to maintain or improve their cognitive function at any age. By adopting these strategies early and consistently, she believes we can significantly reduce the impact of Alzheimer's disease and other forms of cognitive decline in our society.